The sight of a Chinook helicopter landing on the playground in Sarteneja village brought much excitement to the quiet Corozal community. Hundreds of villagers, young and old, came out to take advantage of some free medical services offered by the United States military in conjunction with the Ministry of Health.
We're providing health services to the local populations of Copperbank and Sarteneja.
It is part of what's known as Medrete, the yearly readiness training exercise for U.S. military personnel. Captain Joseph Swendenman is the officer commanding Medrete 2013.
What we're here for is to ensure that in the event of a natural disaster, we have the capabilities to deploy forward and provide support in case of a earthquake or a hurricane or something like that.
How many men and women from the U.S. military are here on this exercise?
Well, we have 25 soldiers here on ground, and with 4 or 5 support staff, which is myself and my crew, and we're the ones who kind of command and control the whole thing. And we also bring at least 4 LNOs, which are doctors from Honduras who work with the U.S. there on ground, and they come out and support the exercise as well.
One of those doctors is General Practitioner Miguel Cuello. He is currently serving with Joint Task Force Bravo stationed in Honduras, and during this year's Medrete, he and his colleagues have been seeing various types of ailments from residents of northern Belize.
We are seeing mostly respiratory diseases and also some chronic diseases like diabetes, hypertension is very prevalent in this area. Also some skin conditions, and mostly also some mild aches and sores like headaches, body aches related to work and other things that people do, in the regular activities that cause pain. Those are the most prevalent things that we have seen yesterday and today.
Before going in to see the specialists, the residents are pre-interviewed, then referred to the appropriate room. Desks normally used for writing are transformed into examining tables, and in the end, the patient leaves with a proper diagnosis and medication to go along with it. Does it make it easier to dispense medication, knowing that the symptoms that you're seeing are not very serious?
It is easier, but also takes the same amount of time because you have to make sure that the patient that you're seeing, that condition is not serious. So you have to go through the full physical, do a true interview, get all the information from the patient, and then you can decide if it's something that is not serious or not. But we have with us the doctors from the Ministry of Health that are working shoulder to shoulder with us in the same room. So we find something that we cannot make a diagnosis here, and we think that is something that might be serious, then we send that patient to the local hospital. And the local doctors, they help us to guide us which one is the best health care place to send that patient to.
Minister of Health Pablo Marin says his government is appreciative of this kind of bilateral assistance.
Well, any assistance is very grateful, and much more from the U.S. because everybody looks at the U.S. As the highest standard of medical practitioners, and when they come here, our people look at that, and then from that they are doing a follow-up of whatever they encounter with the patient.
This exercise, it travels around the country. This year they're in the north. Does the ministry factor this into its yearly plan?
Sure. What we are doing also, because they are looking at the patients here, we are putting everything on the BHIS system, so we will be able to do a follow-up with the patient. And what I spoke to the doctor is that whenever they come back again, at least take 5 patients at random and then ask the ministry, show me the follow-up from those patients so they can know that what they're doing is very effective.
We come with our assets, especially the helicopters, to help the local government to go to areas that are difficult to access because of roads or because of flooding or because of rivers that are overflow. So for me, it's a great way to be prepared.
Well, the Medretes are the key piece of our training. In order to deploy forward, like say what happened in Haiti and stuff, we had been conducting Medretes for years and years and years, and we knew, what to kind of expect when we get on ground. We have the equipment available to go forward and do, say, surgeries and things of that nature. And without these exercises, we wouldn't know what to bring or how to get out there and, things of that nature. So.
And how important is the helicopter support that you get on these exercises?
Well, that's the key, actually, to the exercises. In order to get us out here quickly and efficiently, we use helicopters. We actually just did the other week we did a mission down to Panama and flew helicopters all the way down there as well. So we use helicopters extensively in this area, and the fact that we have which is the 228th helicopter wing in Honduras with us, that's actually why we can get around and do what we do.
The United States, according to Ambassador Vinay Tumalapalli, always stands ready to assist, and he was personally on the ground in Sartaneja village to thank the men and women of the U.S. military for the service they provide.
It's primarily a medical mission. We do once, twice, sometimes 3 times a year. And the different groups that come and work with the Belizean Ministry of Health and Ministry of Education. The primary objective is to come out and work with the authorities, our partners in Belize, with these respective ministries that I just mentioned, to go into areas that are rural, sort of not close to clinics, not close to Belize City or Orange Walk or Cayo, where access is somewhat difficult for people in the village. They see patients at all levels. A lot of it is geared towards preventive medicine, preventive dentistry, making sure children understand the importance of hygiene, the importance of getting checkups, periodic checkups for parents and grandparents and so on. And we do a whole lot of things here.
The Medrete exercises keep the American military personnel in a state of readiness in case of a disaster. But on a personal level, it is an experience that money can't buy.
Well, and that's the thing. I talk to my wife about that a lot, and we really talk back and forth. And we've been married for 9 years, so it's we're used to the military and used to the movement. But the satisfaction I get personally and what I can bring back home whenever I do is just, the smiles on the face of the kids and stuff when we get to do things like this. And the satisfaction to know that, you're making a difference and some sort of an impact in the world rather than just, sitting on the sidelines.
This is a unique opportunity for me personally. It helps me to see that people in all Central America, we cover with the AT Bravo all Central America, from Belize all the way down to Panama, that people are friendly, but also that we can help. That there is some areas, not that the country doesn't have the information or doesn't have the resources, sometimes is not enough capability to go to the places that are far away.
At the conclusion of the exercise in Sartaneja village, the U.S. Marines returned to their base in Honduras, having completed another successful tour of duty on the training circuit, and taking with them memories that will last a lifetime. Reporting for Love News, I am Patrick Jones.